my heart just started, like it was just beating out my chest, and I felt like I was, short of breath. I thought I was having a heart attack. Lungs clear. What a relief. Treatment usually starts with lifestyle changes like watching your diet, exercising regularly, and ding, 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 quitting smoking. Okay, so whatever you do, what's done in the dark will come to the light, honey. Okay, we have got to take care of ourselves.
Come on while you work out. Stay fit, watch me. I do product reviews and the taste test. Sell my channel like a movie, they ain't make it. Unboxing what I be unboxing, I'm straight, yeah. Come by with positive vibes. Visit my channel that like and subscribe. Come by with positive vibes. Visit my channel that like and subscribe.
Hello, everybody. It's your girl, Frugal Mama, and today I have a special video for you. I have the results of my full body scan. That's right. I had a full body scan in October, and so I am sharing the results with you. I had recorded the video, had scheduled it to premiere, and I said something just said, pull it back, pull it back. You don't want to present anything as medical advice or recommendations or anything like that. Remember, always check with a doctor, medical professional before starting any diet exercise routine. I am not a doctor or a medical professional. I'm just a girl on social media trying to have me some fun and get healthier, baby. With that being said, that means that you are held accountable and responsible for your thoughts, your actions, and the repercussion thereof. So let's all make good choices. I apologize for the glare, but I don't know what else to do because I got to be able to see. Anyway, so in I want to say October. Let's see. Yes, October 11th, I had a full body scan at Visionary Wellness, and I would say no promo, but yes, they have provided me with a promo code for you all to be. This video is not sponsored. I pay this for these bodies, all the scans and tests out of my own pocket, all the services that I mentioned from my own pocket and everything. So this video is not sponsored and it is not medical advice. So, but it's called Visionary Wellness and it is in Irving, Texas. They provide screenings. Okay, this is not analytic tests. These are not analytic tests. These are not invasive procedures that I had completed. Okay, so in October, before October, I started feeling pains in my back, and I remember that when my dad had got sick and he had gotten diagnosed with cancer, one of the first signs was this pain in his back, this excruciating pain in his back, and I started to have that. Well, I ain't gonna say that pain, but I had back pain. And so I was like, oh my gosh, I finally just pushed it too far. God has said, okay, I done told you, you need to straighten up. And so I thought I had cancer, y'all. I thought I had lung cancer. But so I wanted to see what was going on. But I didn't want, at times, the medical profession that I have had experience with kind of give you the runaround. You first got to go get blood test over here. First, then you got to go get this done so you can qualify for this test. And then you got to get this done so you qualify for this test. And nobody got time for that. So I wanted a comprehensive exam that would give me a baseline to know what was going on at the time. Because, within a day, things change. Okay. Can change. Okay. So, but nonetheless, I had a full body scan completed as well as an ultrasound on my thyroid and my thoracic arteries. And so we're going to talk about that. Okay, so that's what led me to getting the body scan. I thought I was on my way up out of here. Okay, and that frightened me, really concerned me. And then once I got the results, I had already started getting treated for acupuncture and acupressure, as well as when I got my annual exam in August, I believe, I basically was put on anxiety medication because of my reaction there. I just started crying. Well, I'm overwhelmed and this. And I was just overwhelmed. And so she put me on Seroquel, and she wanted me to come back and see her in a month to see how everything was going. Well, I was sleeping better. Oh my gosh. When you don't get enough sleep, it can affect every aspect of your life. And so with me sleeping better, I was less reactive. Even my child just told me the other day, he's like, yeah, you over the past 4 months. I'm like, oh my goodness. He's like, really? paying attention. And he does not, I don't think he really knows that I'm on medication. I don't know. The kids are very perceptive, but I didn't say I don't want mommy's on medication to get better. I just said I'm trying my best to not be so, reactive, like pick it up, some of this is out of place, and so that will lead to this body scan, my desire for a body scan. And so I started the Seroquel before I got the body scan. And then I've been going off and on to chiropractic care because I have some spinal injuries, arthritis all over and everything else. And so I try to go at least once a month to chiropractic. And then so I did start going to an acupuncturist who specializes in the treatment of allergies as well. So if you're looking for a clinician, type in NAET, what is it saying? NAET.com/practitioner locator site. That's the practitioner. That's how you can find a practitioner in your area. I'll put it down in the description. Anyway, they specialize in the treatment of allergies and allergy related conditions. And so a lot of things that we experience are allergy related. And so myself, as well as my son and Tasha, is actually going through this treatment. Okay, so if you join the live stream, I give all kind of updates that is not, as I progress. So this is just to go over the body scan results. And I also started going to assisted stretching, and they did a exam on my movement. They did this exam on my movement. They had me do a few squats, and this computer analyzed my movement. And I'll show you the results of that as well and where we go from here. Okay, so let's start off. First and foremost, let's share this. And this is the CT results. So they did a CT of the chest, the abdomen, the pelvis, and gave a calcium score. I don't remember the calcium score business. Anyway, so let's see. Like history. This is a screening. Remember, this is screening, not no deep dive analysis. And it is read by a certified radiologist. Okay. And with that, I just feel like I would be empowered to know where to go from there. And I did. I'm going to share that with you all after I read the results, because I'm going to tell you something else that happened. Okay. So here we have the comparison, none, because I hadn't had another previous scan. But what I liked about this facility is it's a one-stop shop. They were able to do all the areas of my body in one session, and I didn't have to go from facility to facility. And they do have packages which allow you to sort of like pre-paying for my chiropractic services. I bought a package of 10 because I know I'm going, you know what I mean, for my chiropractic services. All right, but anyway, yes, everything is paid out of my pocket. Okay. Technique: CT chest, abdomen, and pelvis without intravenous contrast. That's important to know because those can identify, different things. We had NPR. I don't know what that stands for. Reformats included. Non-contrast gated imaging of the heart was performed. Okay. So these are the findings. Don't come for me with how I pronounce these words. I'm doing the best I can. Okay. But you can see for yourself. You can do it all that you need to do. Okay, so we have the heart normal. Okay, we have the media sternum normal. Okay, the great vessels normal. Lungs clear. Ah, what a relief. The trachea, esophagus normal. The thoracic entail normal. Okay, liver unremarkable. Gallbladder unremarkable. Pancreas unremarkable. Spleen normal. Adrenals no masses. Yes, I just discovered how important the adrenals are. Okay, kidneys unremarkable. Aorta normal caliber. And then you see what it says: non-obstructive calcified aortic plaque is noted in the abdominal segment. Okay, so that's important to note. Bowel loops No bowel obstruction is identified. Appendix unremarkable. And what is that? Whatever that is. No free air or abscessed. Bladder unremarkable. Yeah, I just did this whole video, but when I went to download it, there was no sound. So therefore, thus thou, I had to re-record this. So I'm kind of like tired at this point, but I put on my things to do, that required discipline, that I was gonna get this recorded. Actually, I said I was gonna record it tomorrow, but since my face is already, beat, as beat as it's gonna get, I said let me go ahead and record this today, and it's already, late. So anyway, you got an extra all that. Bladder unremarkable. Okay, next. So here we go. Pelvic organs unremarkable. Bones unremarkable. Coronary arteries unremarkable. Impression. So this is where it gives like a synopsis, a scenario. No acute cardiopulmonary process. No worrisome abdominal or pelvic process. Here we go. Abdominal aortic arteriosclerosis. So let me look up arteriosclerosis for you. So you have the facts. Not my summary of it. Okay, what is this? Let me look. Absolutely aortic. And I didn't know that this was a thing. Okay, I knew what arteriosclerosis was, but I didn't know we had this aortic arteriosclerosis. Okay, so I'm just going by a quick Google search. So here we go. Aortic arteriosclerosis, sorry about that, is a condition where plaque builds up in the aorta, the main artery that carries oxygenated blood from the heart to the rest of the body. Plaque is a buildup of fat, cholesterol, calcium, and other substances that can narrow and harden the aorta, reducing blood flow. This can increase the risk of complications like aneurysms, dissections, and something artery disease. So I can't think of how to say that word. Aortic arteriosclerosis is a common condition that develops gradually over many years, and you may not experience symptoms until a medical emergency occurs. Symptoms include extreme tiredness, loss of appetite, nausea, swelling of hands and feet, changes in urination, itchiness, or numbness. They found me a cardiologist, and they scheduled the appointment for me. Yeah, I was like, this is beyond great customer service. Anyway, I did go to the cardiologist. They had an exam, then they scheduled me again for a stress test just to be safe. He said, I don't think that you have any issues. They listened to me. They felt the pressure in my arteries, in my legs, my hips, and my neck, and my arms, everything. They did all that. And he said, I don't really feel like you have any cardiac issues, but we're going to do a stress test just to confirm my findings. So a couple of weeks later, I went to get my stress test, and everything was good. Okay, so and they actually said your conditioning is better than you could probably even think it is. Your heart is functioning like an athlete, at an athlete caliber. I said, all right now, all right. So anyway, let me see. I'm going to the next exam. If you think you have arteriosclerosis, you should make an appointment for a health checkup. Early diagnosis and treatment can help prevent arteriosclerosis from worsening and can help prevent a heart attack, stroke, or other medical emergency. Treatment usually starts with lifestyle changes like watching your diet, exercising regularly, and ding, 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 quitting smoking. Okay, so whatever you do, what's done in the dark will come to the light, honey. Okay. We have got to take care of ourselves. That was the concern. After I got these results, I took them to my acupuncturist and the person who I'm seeing primarily, because I only see my primary care physician every 3 months. And then when I go back to see her, I'm gonna give it these results as well. And so his concern was the arteriosclerosis. And it says calcium score 0, rank percentile 0. 100% of the gender and age match cohort will have a gradient calcium score, which I don't know if they tested that, because that seems like my calcium score is 0. That seems kind of odd. But nonetheless, I know that my calcium should be fine because I had a full blood panel done. I don't feel like pulling it up right now. So I don't know. It probably was not measured. I don't know. I probably need to ask about that. See, it's good to go over the findings, right? So this is the final. This is the final results for the ultrasound of my thyroid. Okay, this is a screening. Remember, it's just a screening. Real-time ultrasound examination of the thyroid was performed and reviewed on a PACS workstation and with permanent imaging recording. Okay, I don't know what PACS is, but it's something in the radiology world. Okay, it's probably some computer. I don't know. Okay, so it talked about the right lobe, the left lobe, and the isothermus and the measurements. So it says that the thyroid echo texture is mildly heterogeneous on the right side. No worrisome, this is good, no worrisome discrete thyroid nodule. There is no evidence of lymphodenopathy. Woo! Impression, mild thyroid heterogeneity, don't come for me, on the right without discrete nodal. Correlate with thyroid function test. So if you want to know more, they say basically, if you want to know more, that doggone get some more tests. This as far as this examination gonna go. But I did talk to my acupuncturist, and they said the main concern is the arteriosclerosis. Okay. And so we making the dietary change. We made slight dietary changes and all of that. So, but after I was at work, y'all, and I thought I was having a heart attack. I thought I was having a heart attack. And if you join the live stream, this is all, I already talked about these. If you join the morning live streams, Monday through Friday, 6 a.m. Central Standard Time, you would already heard about this. I was talking to someone about some changes that was happening, and my heart just started, like it was just beating out my chest, and I felt like I was, short of breath. I thought I was having a heart attack, yeah. And then it just felt like somebody was hugging me real tight, real tight. And I couldn't move. I was just like this stuff. And I said, I'm going to go to the hospital. I told them I'm going to the hospital now. And so I did. I went to the hospital. They did a calcium test. So I know that that's good. They did blood tests and EKG, EEGs, all kind of stuff. And they determined that I was not having any cardiac emergencies at that time, nor had I had any. So they can look back at it previously. So that was good. So my heart is good, y'all. I'm Gucci. But they also, let me tell y'all, shout out to Medical City. And because they, not only when I left the emergency room, somebody called me and said, hey, how you doing? We just want to follow up, as well as someone called to make a referral to a cardiologist just to see if I wanted for them to help me with the referral process. And so that was just like amazing. And next up, we have the bilateral carotid artery Doppler exam. And so this one is, let's see, bilateral grayscale and Doppler imaging of the carotid arteries was performed. Let's see, make this a little bigger. Internal thickness was measured bilateral. Okay, so then it says grayscale and color Doppler imaging of the bilateral neck vessels demonstrates no evidence of peak scholastic. Oh my God. Systolic velocity elevation to suggest hemodynamically significant liminostenosis. So I got thrown out. So sorry about that. So the final impressions for the screening, which one is this? The carotid artery screening was no significant carotid stenosis based upon grayscale imaging, no evidence of significant or age-appropriate intimal thickening. Why is that so? Anyway, no evidence of hemodynamical significant carotid stenosis of the bilateral common and internal carotid arteries. Okay, and that is the radiologist, and they say that he is one of the best. Like he try people, different facilities try to recruit him. Okay, so but anyway, those are the results of the body scan and the ultrasounds that I had. So, what am I doing? What am I doing now? So, go see my primary care physician every 3 months to talk about the anxiety and the medication. Cardiologist, I won't see them for another, what do you say, year, 2 years, 2 or 3 years. I think year, maybe a year from now. I don't remember. But it's like you really don't have nothing to worry about. Then number 3, chiropractic, the chiropractor. I try to see them at least once a month. I wish I could go every week because that consistency is what helps you see the greatest changes. And then for the acupuncturist and who specializes in allergy and allergy related conditions. A lot of things that you may have, like a pain here, could be that you had an allergic reaction to this, that, or the other. So, like one of the things is you can have allergic to jewelry. That's why I take my ring out. Is because you have allergy to the metal itself or the diamond, and that could cause. I'm trying to do anything that explains or can treat this pain here in my neck and on down. And when I get the acupuncture for about 2 or 3 days, I'm good, and then it's back. You know, but it hasn't gotten back to the point it was when I first started. But also with the back pain and stuff like that, it could be from the heart. When my heart is not functioning, and that's why I have the condition. It impacts the condition with my circulation in my legs. You can see that chart. I have venous influx disease, where basically the valves in your vein should go up and down, up and down and up and down and up and down. But mine is kind of like it doesn't flop up and down like it's supposed to, so it allows blood to pool, and then you get the bruising in your leg. Anyway, I'm explaining everything in a non-medical way, but it is what it is. Hope you understand. All right, so I go there once a week for acupuncture, acupressure, and allergy treatments. And I'll tell you that I spoke about being allergic to the vitamin D, but it doesn't mean that he's going to work on the treatment of the vitamin D allergy. Anyway, going to stretch lab. Oh, let me show y'all that too. Let me show y'all stretching, y'all. It can be very therapeutic. Okay, let's see. So I had it's called a Physmodo assessment, and here are the results. So overall score, I did this one November 23rd, and then in a month I will have another one to see the progress. And every time I go, I think I've been 3 times, I have seen the progress in my flexibility and mobility. So as you can see, in my overall score is 43. I don't know what it's on the scale of. So I may have to ask what's it on the scale of. And then my mobility is 53, activation 27, posture 41, symmetry 50. So when I get more information about that, so somewhere around the 21st or 28th, I have another scan. Basically, this computer monitors your movement while you do like a few squats, and so it'll let you know, give you this computerized thingamajiggy. Okay, so let me see what else. And so I'm doing that once a week. Let me go back over here so I can make myself full screen. Doing that once a week. I'm going to, for compression, at least once a month. I would like to go once a week, have my compression done, and I also usually go in the infrared sauna to release toxins from the body, and that has been phenomenal. It's also the place where you can get the cryo, but since I have this aversion, my blood vessel don't need that restrictions right now. So you said no cold, so no cold right now. But I'm looking forward to doing it again because I felt like a brand new woman. I didn't have the aches and pains like that for a minute, like a week or two. It was amazing. I guess like it took out all the swelling when I did cryo, and I missed that, y'all. But it doesn't mean that I will never be able to have it, but I will probably be able to once I, go get past all the hurdles. So yeah, um, and the clinician said no smoking, no salt, added salt. I'll try to significantly reduce it. No sugar, no added sugar. Fruits, fine if it's naturally in there. And no smoking, no alcohol, no caffeine. Oh boy! So it's been 72 days, and I have not had any of the things that I'm really not supposed to have. I did have like sometimes I had like I try to I really just try not to avoid anything with the salt in there, but I don't add salt. So, but nonetheless, let me see what else. Make sure I'm getting everything, covering everything. And before I eat, I have to have water with apple cider vinegar 30 minutes before I eat. And then I have greens first, like salad, asparagus, broccoli, um, green beans, whatever, something green to kind of go ahead and cleanse on down those intestines. And then the protein, and then anything else, carbs and stuff like that afterwards. So yeah, that's it. I'm like, shoot, after I eat my protein, I'm like, what's left? Ain't nothing left. Ain't nothing left. So let me know if you have any questions in the comments down below. I'll have the referral code for Visionary Wellness. And I will have where you can find you a clinician that treats allergies with this technique. And because they all over the United States. So yeah. And then don't forget, like, comment, and subscribe so I can see you all in the next one. Peace.
Doing some unboxing and I'm working out, hey. Reviewing all these products and I'm working out, hey. I got the Don Dotty Gold, cause it's all about the mind, body, soul.